Hi, I'm Ashley Harbison. I'm a lactation consultant here at Owensboro Health. So last week, Elaine Berry talked to you about the top 10 reasons to breastfeed your baby, and I wanted to continue with that today and talk to you about exclusive breastfeeding, what it is, why it's important, and how to get off to the very best start here in the hospital. The American Academy of Pediatrics recommends 6 months of exclusive breastfeeding. That means nothing but breast milk for your baby for a full 6 months, and then with the addition of complementary foods around that 6-month period. And we want you to continue breastfeeding as long as it works for you and your baby. Your milk is the perfect first food for your baby. It's easily digested with the perfect ratio of fat, protein, and carbohydrate, along with some amazing immune supporting factors that only exist in your milk. At Owensboro Health, we're committed to improving the health and wellness of our community, and that includes your baby. The first days with babies are nature's golden opportunity for establishing your milk production, and there are many things we can do during your hospital stay to help you and your baby get off to the very best start. First, request that your baby be placed skin on skin with you immediately after delivery, and hold your baby there for at least a couple hours. During this time, he will have his first breastfeeding, which usually happens within that first hour if baby's allowed to stay on mom's chest. You can even have the skin-on-skin time if you have a C-section, and it's really important, regardless of your feeding preference, that you get the skin-on-skin time with baby. It helps to stabilize his temperature, his respiratory rate, his blood sugar, helps promote bonding, reduces mom's pain and bleeding, and baby has an easier transition to the world as he hears your heart sounds and lung sounds, those things that are so familiar and remind him of his home in the womb. During that first hour after birth, your baby will also be most alert. He's likely to get a little bit sleepier after that first couple hours during his first day as he experiences all these new things that the world has to offer. So we encourage you during that first hour, that golden hour, to focus on skin-to-skin feeding, bonding with your baby. Procedures like length and weight, erythromycin eye ointment, and footprinting can be delayed until after that first feeding is accomplished. We also want you to consider limiting visitors. While we certainly want you to experience and celebrate the birth of your baby with your family and friends, you will be tired, and it does take a lot of time and practice to learn how to breastfeed. So we want you to really make rest a priority and promoting that bonding experience with your baby during the first days. At Owensboro Health, we're also practicing what's called rooming in. You might have heard about this in the community. We're keeping moms and babies together in the postpartum room for even up to 24 hours out of the day. There's no real reason that your baby should have to leave your room unless you have a little boy which you're planning to circumcise. What research shows is that moms and babies rest and recover better together. Keeping baby in a room also allows you to learn and respond quickly to his hunger cues. So things like bringing his hands to his mouth, sticking his little tongue out, turning his head to the side, maybe trying to eat his blanket. These are all the feeding cues that you want to respond to and offer him the breast during that time. Crying is a late sign of hunger, and it's much more difficult to latch a baby who's upset and agitated. So learning those hunger cues, responding quickly, also helps to build trust between you and your baby, and really promotes that initial bonding experience. Now, if your baby's sleepy, which is a common experience of our new moms, we encourage you to hold him skin on skin and learn to and practice hand expression of drops of your milk, and your nurse can kind of show you how to do that. There are lots of things we can do with sleepy babies, and that's pretty normal too in the first few days. Lots of nursing in the first few days means lots of milk later. This is a supply and demand system. So we want to pretty much allow your baby unlimited access to the breast in the first weeks. We want to start your feeding skin to skin if at all possible. Your baby's instincts will be stronger, and he will nurse better that way. It also helps to stimulate more of the hormones that help to make milk and help you to bond and connect with your baby, to also feel calm and reduce your risk of postpartum bleeding. It's also really important that you avoid unnecessary supplements and artificial nipples in the first few weeks when baby's learning to breastfeed. It's much easier to learn one skill at a time, and babies do suck differently on a pacifier or an artificial nipple than they do at the breast. So we really want to allow baby plenty of practice time at the breast and just learn that one thing at a time. As we talked about before, milk production is a supply and demand system. So the more baby comes to the breast and the more effectively he removes milk, the more milk you'll make in the long term. So this does take time and practice to learn how to latch effectively and to establish your milk production. So we really want to get plenty of practice and lots of stimulation in those first days to get you off to the very best start. Special circumstances, we know those things happen, so things like jaundice, blood sugar instability, preterm birth, things like that may require some supplementation, and we understand that too. The ideal supplement is mom's own milk, so we will do all that we can to help you to increase your milk production really quickly so that baby gets the calories and nutrients that he needs while he's growing. If supplement is necessary, we can offer that supplement with a spoon, with a finger, or using a supplemental nursing system at the breast. Just remember that anytime baby's getting any feedings that aren't coming directly from breastfeeding, it's really important for mom to use a breast pump in order to establish, maintain her milk production because of that supply and demand system. So as you know, as you've heard, there are lots of options and lots of things we can do in the first few days and weeks to get you off to the very best start with exclusive breastfeeding to meet that AAP recommendation of 6 months of exclusive breastfeeding for your baby. So please call for help while you're here in the hospital. Call for help before your baby's born. Call for help after your baby's born. We're here for you along your breastfeeding journey or with any questions that you might have as you're learning to breastfeed and as you go along your initial experience with your new baby. Here at Owensboro Health, we're dedicated to helping you guys get off to the very best start. Most moms are capable of making the perfect amount of milk for their baby with the right help and support. So give us a call, send us an email, and make plans to attend our next Breastfeeding Friends meeting on April 21st. Have a great day.